Hi, my name is Rosemary Hill. I'm a nurse who specializes in wound, ostomy, and continence care. Currently, I practice in North Vancouver, British Columbia. Today, I'd like to talk to you about improving wound care management and patient engagement with the use of MolecuLight. I'm not sure how many of you are familiar with this particular tool, but you will shine a fluorescent light at the wound bed, and it is going to give you a real right there in point of time picture of what's going on at the wound bed in terms of where the bacteria is located, and you're going to get an impression as to what's happening at the wound surface. Today, I'd like to describe to you a little bit about a study that we did over about a 7-week period, where we looked at around 40 different patients, their complex wounds, and we used the MolecuLight. And I want to share with you some of our findings, specifically findings around how it assisted us with targeting sampling, targeting debridement. It also actually contributed to guiding our selection of antimicrobials. And you know, there were times where it allowed us with confidence to proceed with skin grafting. But before I go into some of those aspects, let's just take a moment to see what does a wound look like when it is viewed with fluorescence. So you'll notice in this slide, the area where it's bright red, that indicates there's a heavy burden or preponderance of bacteria, which I know now means that it's at least 10 to the 4 or greater in terms of the degree of bacteria that's present. So the fluorescence red indicates a heavy load of bacteria, which, as you can imagine, would guide debridement at times or sampling. You know, I want to share this next case study with you. It was a fellow he was a 77-year-old gentleman who was found down as a result of a subdural hematoma, and he sustained a really nasty pressure injury to the coccyx region. Let's just take a look at some of his photos when he first arrived to us. So first of all, he presented with just a nasty black eschar, which we began to try to soften up to make it amenable for bedside debridement. And then our plastic surgeon performed debridement to that area, removing the necrotic tissue. But you know, about a week later, we thought, let's just take another look at that wound bed. And it was interesting. There was an area which honestly, I don't think my naked eye would have picked up. But using the MolecuLight, it really spoke to me in terms of where the burden of bacteria was loaded. And remember, that red is, again, it's going to be moderate to heavy growth. In other words, 10 to the 4 or greater. And so again, this targeted our debridement. And so we removed all the areas where there was the red fluorescing, and then we re-imaged. Interestingly enough, 48 hours later, there was no reoccurrence. And that's where I found the MolecuLight very helpful. But let me take you to another area. I want to share with you about this lady in terms of trying to plan what were the next steps for her. And she was a 93-year-old lady who had had a fall. She was somebody who always faithfully used her walker, but had decided that maybe this time she didn't quite need it. And sadly, she had a nasty fall and fractured her hip. She had, as you can imagine, at 93, she had quite a complicated medical history, as listed there on the slide. So she was recovering from her fractured hip surgery, and there was talking with the discharge planning team of what were the next steps for her, where should she go, how was she going to manage her daily activities. And so, but it was noted that she had a pressure injury. So I was asked to go to the bedside to say, Rosemary, could you suggest a treatment care plan for this lady in terms of her next steps, whether it was going to be a long-term care facility, and how they should care for this particular wound or pressure injury. And so once again, it was quite interesting when I looked at this yellow eschar area However, you'll note there was some erythema. I said, you know, I'm just going to go get the MolecuLight. I think let's just take the light and let's just shine the light and see what it's going to tell us. And of course, there was a real bright red fluorescence. And it's interesting to see that, you know, in addition to this wound, this patient also had pain. And so once again, I was able to bring the physician to the bedside and to say, you know, I want to talk to you a little bit about what's happening with this wound and the burden of bacteria. And so there was a whole change of thought and plan to the next steps for this particular lady. And actually, we cultured, and of course, it was very heavy, had a heavy growth of mixed coliforms and enterococcus, and then there was a heavy growth of mixed anaerobes. And we began a new treatment plan. And we took time to talk to the patient because she was really keen to move to an area that was less acute care focused. And so again, we involved the patient to say, you know, there's been new information has presented it to us all as a result of using this MolecuLight. And we can see in your wound, there is a lot of bacteria. And so we want to deal with that first. We want to have that stable before you go on to the next steps in your care journey. Sometimes the MolecuLight also guided some of our antimicrobial use. And I want to tell you about this 63-year-old fellow. He had a cat, and his cat was about to get into a fight with another cat. So he quickly retrieved it, and it was strange and unexpected for him, but the cat turned on him and took quite a nasty bite out of his leg. 3 weeks later, he presented himself to our outpatient clinic with a very painful area, a painful wound area. It actually just looked like black eschar, and you can see that in the white image. But actually, again, with the MolecuLight, it just lit up a bright red. And indeed, the cultures, of course, showed a heavy growth of Pasteurella multocida, which is a classic organism that you find in cats. And you see, their teeth, cats' teeth are so sharp. And so it would have been quite a puncture. And so this had quite a nasty growth. And so I was able to talk to the patient about just some of the things that when you have a cat, this is a classic type of organism. And so we began our treatment based on the story, but also seeing the imaging from the MolecuLight. I also chose to use wound care products that would really address that antimicrobial situation. And I reached for the Cadexomer iodine. And very impressive how many weeks later he went on to close and heal, keeping in mind that that was an abscess because there was some real nasty material underneath that black eschar. Let me share with you another story, though, of a 51-year-old fellow who had type 2 diabetes. But he had an obstructing right colon adenocarcinoma. And on the 5th of December, he had a right hemicolectomy, and then on the 14th, he developed an anastomotic leak and intra-abdominal sepsis. What you'll see in the picture here, the white image, you classically see the wound, and he had a temporary ileostomy. But have a look at that fluorescence image. This is powerful information because I want you to see not only is the red fluorescing in the wound bed, but it's actually the wound exudate has slipped into his skin fold just below his abdomen, and you can see all of that wound exudate, a bright, bright red. That's absolutely heavily loaded with bacteria. And I don't think sometimes we realize as we're cleansing wounds and taking care of the contamination of bacteria to the surrounding area. So then after doing that fluorescence, I began wound hygiene, wound cleanup. And you can see what a difference post-cleansing in terms of the decrease in the fluorescence as well as some debridement. And so it really guided both my wound hygiene and my debridement practices. You know, I think with this particular gentleman, he was interested in seeing the images, and there was a sense of hope in him when I would show him the new images as we continued to see improvement in his wound and less red. And so I love the tool for that reason as well. There's a real patient engagement, dialogue about how their wound is doing and how they're improving, and it offers hope. You know, I can use words like, wow, the granulation tissue is better, but when he sees the image of less red, that speaks volumes. So let's talk a little bit more about engaging patients. I also want to tell you in this instance about a 60-year-old woman who had a real nasty post-surgical site infection after a total abdominal hysterectomy for a large uterine fibroid. And it had heavy growth of Morganella and an anaerobic feculent bacteria. So this particular lady, this was so unexpected for her to develop this surgical site infection. So following debridement and surgery, she was anxious and she was looking for reassurance that the bacteria was not going to come back. So I brought the MolecuLight to the bedside and I explained to her that, you know what we're going to do? We're going to shine a light on your wound, and I'm going to show it to you. And if I see any areas of red fluorescing, that means there's a little bit of bacteria and we're going to deal with it. And if it's not, then that's going to offer reassurance that we're on the right pathway. So we would do that, and it was a fairly large area, so I would just carefully walk my MolecuLight 10 centimeters away, just over the wound bed, and show her the images. In the early days, because of her anxiety with her wound, in the first dressing change, we actually, at her request, she would request Ativan. And after showing her the images, she said, "You have no idea how much reassurance that offers me." So her particular dressing change was Monday, Wednesday, Friday. So the following Wednesday, when I came to do her dressing change, she said, "Have you got your tool? I want the tool. I don't want the Ativan. I want your tool, because that is what helps my anxiety." And so it was really fascinating to see how the impact it had to her and the relief she had following each dressing change. Let's just talk very quickly also just again about the pre and post cleansing and the patient engagement that can happen. So this was a gentleman who was bariatric, but he had long-standing venous leg ulcers. So again, when he came to clinic, he had a fair bit of Pseudomonas, and that's demonstrated as a cyan color with the MolecuLight. So it's not the red, but it's a special cyan color. And so I said, we're looking at your wound and I can see there's Pseudomonas there. So I'd like to take the opportunity to cleanse your wound, and I'll be careful because I know it's tender, but I just want to show you the difference in terms of wound cleansing. And then we'll re-image your leg. And it's fascinating to see the difference of proper wound hygiene, and there's a satisfaction of eliminating some of that superficial and peri-wound Pseudomonas. One last case study I'll share with you was around the skin graft application. We had a gentleman, 36, who had a real nasty trauma in the States, and then he was from Canada, and he came back up to us for his follow-up care. When he arrived with us, we quickly looked over all of his wounds, and in particular, he had some full thickness injuries on his arm. And so we said, well, we knew he needed to be skin grafted, and these things take a while. But we said, look, before we start booking the OR and planning skin graft, why don't we MolecuLight it? Why don't we take a moment, have a look, and see if there's a preponderance or a burden of bacteria? Because we know our eye sometimes does not pick it up. And obviously planning and booking an OR takes time. And so it was a wonderful opportunity where we were able to use the MolecuLight, look at it, book the OR for the skin graft, and by the way, the swabs later came back that there was no growth. So there was no bright red fluorescence imaging. So let's just take a moment to summarize. As we look back over all of those cases that I shared with you, real-time, point-of-care bacterial fluorescence imaging with the MolecuLight. It absolutely facilitated sampling, targeted debridement. It also guided antimicrobial usage. It also guided product selection. And of course, in terms of patient engagement, it was invaluable as they began to really participate in their care and watch and observe the improvements. And well, it offered hope. So anyway, I thank you for today. I thank you that I've had this opportunity to share my experiences with MolecuLight and my learnings. And I will continue to learn more and more about this tool and how it contributes and is a real significant part of my wound care and my wound management and also patient engagement.